John, do you want to help me start off with directions on what we'll be addressing first?
Sure. I think that what we want to do, as Sanjay said, is some of this will be review for you, and for those of you who are joining us for the first time, um, it won't be. So what we wanted to start off with is looking at the dashboard that Johns Hopkins University puts out, and I will throw that up on the screen here. Go.
Okay, so every week we've been reviewing the numbers to begin with, and as you can see, we're now approaching 5 million confirmed cases across the globe, and this is clearly a pandemic. This is not an epidemic. This is
Sanjay, I think we lost your sound here for a second.
okay. Are we better on the sound?
There we go.
Okay, so I mean, this emerged from Wuhan probably in November, December, and started to spread in Europe, and then obviously came to us by late January and February. And this is just an unbelievable, once in a lifetime event. At least we hope it's once in a lifetime. So we now have 1.5 million cases here in the United States. We're both the leader in the number of cases, as well as the number of those of our citizens claimed by the disease. Globally, 322,000 people have died. In the United States, we crossed over 90,000. We're now at 91,730, with a prediction that by June we will cross 100,000 dead as a result of this pandemic. So there's a graph that John and I wanted to show you that's kind of indicative of where we are. If you click on the United States and click on daily cases, you see that this is the massive cases in the United States is on a gradual decline now. However, when you compare this graph of decline to what we're seeing in the hardest hit countries in Europe, who had very, very strict measures implemented after their health systems were initially overwhelmed. John, if you could bring up Italy. So Italy was where we began to see, the healthcare system overwhelmed, the resources of their certain regions, especially like Lombardy, and also in the south, Foggia. I hope I'm pronouncing that correctly for my colleague in Italy who has been sharing her experience there. And the decline is obviously much more dramatic over the same period of time as ours is right now. So we have a lot to learn from successful mitigation in countries like Italy and South Korea. And even before mitigation, there are countries like Taiwan and New Zealand that succeeded in containment. So in epidemiology, we have two responses to pandemic that are the two initial responses. Obviously, one is containment, finding patient zero, tracking and tracing, and then obviously, tamping down on the further spread of it as early as possible. And what that does, obviously, is allow us not to have to go to the next phase, which is mitigation. Now, mitigation is where you have failed at containment, and now you have to go forward with, addressing the public health imperative by asking people to stay away from each other, to stay home, shutting down businesses, as we're clearly have seen here in the United States. So John, zooming in on our location here in Pennsylvania, which is in northeastern Pennsylvania near the Pocono Mountains. Our county is a hotspot, and that's a result of our proximity to northern New Jersey, which is obviously related to the outbreak that occurred in the greater metropolitan area of New York City. So we also have the crossing of the two major arteries, Route 81 and 80, very close by, and this traffic through here is enormous. we have significant traffic between our area and the metropolitan northern New Jersey area of a specific ethnicity. The Hispanic community has a large presence here in our county, and they have a lot of family and businesses that they do commerce with back and forth. So our particular location has resulted in this transit of the virus in larger numbers than our neighboring counties. So that's what's going on. Does anyone have any questions on the counts or how this is, how what we look compared to the rest of the world, and what our declination curve, basically our decline in cases daily means. As John said, all you have to do is unmute yourself and you can ask questions at any time. Am I still muted? Please tell me now.
You're good.
Okay. All right. So what you saw on that map was just the case counts, right? So what molecular biologists and epidemiologists look at, which is of more significance to them, is how the virus has spread and mutated. And these mutations give us a very strong indication of where the virus has traveled to, and what it has learned or picked up along the way molecularly. And so what John's showing you right now is a website called NextStrain, where they're able to plot, based on the data they've accumulated from the genomics of these viruses that have been taken from samples and sequenced. They're able to plot basically what they believe has happened over the course of time. John, if you scroll down a little bit and past the diversity. Yeah, just scroll down there. There you go. So you'll see that right there is mapped out the entire, I'm sorry, up a little bit, John. Yeah, those colors indicate the various genes that are encoded in the 30,000 base pairs. By comparison, the human being has 3 billion base pairs, and we have around 24,500 genes that are known to have function at this time. It may be up to 29,000, I'm not sure, but anywhere between 25 and 30,000 genes have been identified in the human genome. We have identified 29 significant genes in the viral genome. So there's a huge, orders of magnitude difference in the complexity. This is a very simple virus. It is what's known as a positive sense RNA virus. Their viruses are divided into DNA and RNA. RNAs are the simple ones, and because they're simple, they actually have a tendency to mutate more rapidly. In a pandemic event like this, the longer you allow the virus to spread throughout a population, the more opportunity it has for mutation, and then the harder it becomes to start to develop a comprehensive strategy. So, that includes, it may make it harder to develop a vaccine. The longer this is allowed to, develop its own more strains. And one of the things that we learned that was very interesting in the last month is that the infections on the West Coast were due to a completely different strain than the infections on the East Coast here in the United States. So what John is doing here is running through the timescale of the emergence out of Wuhan. And you can see the spread of the purple, the initial locus of infection and where it goes. And we have a question from Karen, and I will cover that. Ask her to ask it in just a moment. So here we go. This is, the travel of the virus from the center over the timescale to May, right at the edge of the circle here. And the various colors represent the various strains and where they emerged, where they traveled to and emerged in the pandemic. So, um, anyone have any questions about this before I go to the counts? Why this is important? This is, I mean, this is important to epidemiologists and all of us that are tracking it at the molecular level. But obviously, this also relates to counts, and the crossover between this and counts will allow us to understand which strains are the most easily spreading, which ones may be the most virulent, based on the location, how, which strains are causing the most case fatality, or, we have different measures of mortality and case fatality, et cetera. So this gives us a better picture than just the raw case counts.